Today we're going to discuss health team communication, which is chapter 8 in your textbook. There are several rules for effective communication in healthcare. First, use words that have the same meaning for the sender and receiver. For instance, does the word far mean 50 feet or 100 feet? The word far will have different meanings for each person. You must ask questions if you do not understand. You must be concise. For instance, do not add information that is unnecessary. Stay on subject. You must provide information in a logical order and give facts and be specific. For instance, heart rate of 110 is more specific than saying fast heart rate. When communicating with members of the healthcare team, it is important to be tolerant and respectful of coworkers, be quiet when others are speaking, listen to the ideas of coworkers, approach new ideas with an open mind, use appropriate voice volume, use appropriate language, and do not gossip about patients. Poor communication can cause conflict in the workplace. The medical record, which is also known as chart or clinical record, is the legal account of a person's condition and response to treatment or care. Medical records can be electronic or written on paper. The electronic health record, EHR, or electronic medical record, EMR, is the electronic version of a patient's medical record. The medical record is a permanent legal document. It can be used in court as legal evidence of the person's problems, treatment, and care. Government and accrediting agencies review medical records to see if license, certification, or accrediting standards have been met. The medical record is also used to determine the amount paid for services. The admission record is completed on admission. It contains personal and identifying information such as name, date of birth, address, and insurance, the date and time of admission, the doctor's name, and consent for treatment. An advance directive is a document stating a person's wishes about end-of-life care. The health history is the history of current illness, past medical history, allergies, family health history, ability to perform ADLs, and assistive devices used. The nursing assessment is data collected during the nurse's physical assessment. Progress notes describe the care given and the person's response and progress. Orders are what the doctor or advanced practice provider would like to occur for the patient, such as medication, physical and occupational therapy orders, or radiology scans. The MAR is the medication administration record. It is a record of drugs ordered, given, and not taken. Lab results and radiology reports and therapy notes are also included in the medical record. The discharge summary is information and instructions for the patient when they leave the facility. This is an example of a sample nursing progress note. Resident states headache started about 1 hour ago, denies nausea and dizziness, no other complaints. Vital signs, temp 98.4 degrees Fahrenheit orally, rapid radial pulse 72 and regular, respirations 18 and unlabored, BP 134/84, left arm lying down, PRN Tylenol given, assisted to bed in position of comfort, lights dimmed, call light in reach, instructed resident to use call light if headache worsens or other symptoms occur. This is a sample flow sheet that you might see in a nursing home where vital signs are documented. This can also be done electronically and charted in the electronic medical record. The Cardex summarizes information in the medical record, medications, treatment, routine care measures, and special needs. The Cardex can be either electronic or on paper as a card file. The Cardex is not part of the patient's permanent medical record. This is a sample of a Cardex. The nursing process is the method nurses use to plan and deliver care. The 5 steps are assessment, nursing diagnosis, planning, implementation, and evaluation. The nursing process is ongoing and continuous. The CNA has a key role in the nursing process, which is to make observations for nursing diagnosis and planning, help develop care plans, and perform tasks in the implementation stage. Observations are also used in the evaluation step. The first stage in the nursing process is assessment. It involves collecting information about the person. The nurse takes a health history about current and past health problems. The family's health history is important. Information from the doctor is reviewed. The nurse assesses the person's body systems and mental status. The CNA will assist with the assessments and make observations as care is provided. An observation is using the senses of sight, hearing, touch, and smell to collect information. You can have either objective or subjective data. Subjective data is the symptoms that a person tells you about that you cannot observe using your senses. For instance, you cannot feel a person's pain, fear, or nausea. Objective data is signs that are seen, heard, felt, or smelled by the observer. For instance, you can feel a pulse. You can see urine color. It's important to note that the CNA can only make observations. The next step in the nursing process is the nursing diagnosis. It describes a health problem that can be treated using nursing measures. A person can have multiple nursing diagnoses. They deal with the person's physical, emotional, social, and spiritual needs. They may change as assessment information changes. A nursing diagnosis is not a medical diagnosis. A medical diagnosis is the identification of a disease or a condition by a doctor, such as diabetes, cancer, heart disease. Doctors use drugs and surgeries to cure or heal. NANDA International is the group that exists to develop, refine, and promote terminology that accurately reflects nurses' clinical judgments. They create the different nursing diagnoses. For instance, bathing self-care deficit is an inability to independently complete cleansing activities. Impaired bed mobility is another sample nursing diagnosis. That just means limitation of independent movement from one bed position to another. Impaired walking is another nursing diagnosis, and that refers to limitation of independent movement within the environment on foot. The next stage in the nursing process is planning. It involves setting priorities and goals. A priority is what is most important for the person. Goals are what is desired for by a person as a result of nursing care, also called objectives. Goals are aimed at the person's highest level of well-being and function. Nursing interventions are chosen after goals are set. An intervention is an action or measure. A nursing intervention is an action or measure taken by the nursing team to help the person reach a goal. A nursing intervention does not need a doctor's order. Fall prevention, providing hygiene, and comfort measures are examples. The nursing care plan is a written guide about the person's nursing care. The nursing care plan contains the person's nursing diagnoses and goals. It also has nursing measures or actions for each goal. It is a communication tool. The minimum data set is a standardized assessment tool that measures the health status of nursing home residents. It provides a structured, standardized approach to care. The individualized, person-centered, multidisciplinary care plan is written by nurses and other members of the team. It is based on the MDS and other client data. The care plan includes resident strengths and routines, eating skills, incontinence management, skincare, cognition, and assistive devices. It outlines the care that the health team must perform to assist the resident in attaining his or her optimal level of functioning. The nurse aide continues to be part of this plan by reporting signs and symptoms that he or she observes. Care conferences are held to share information and ideas about the person's care. The purpose is to develop and revise the nursing care plan. The next stage of the nursing process is implementation. This is when nursing interventions in the care plan are carried out. The nurse will delegate patient care to the CNA. An assignment sheet is used for the nurse to delegate care for the CNA. This is a sample assignment sheet that you might see in a nursing home. This is a sample assignment sheet that you would see in the hospital. It has the patient's name, how much assistance they need, if they need their blood sugar checked, if they're able to feed themselves, how much help they need with bathing, and how they go to the bathroom. Finally, the last step in the nursing process is evaluation. It involves measuring if the goals in the planning step were met. Goals may be totally, partially, or not met at all. The nurse uses assessment information for this step. Changes in the nursing diagnosis goals in the care plan may result. This picture shows the step of the nursing process and how it is continuous. Reporting and recording are important parts of health team communication. Throughout the day, report changes in condition to the appropriate staff member per facility policy. All patient information is confidential. Document care immediately after it is given. Never document before providing patient care. Do not chart for another person. Write notes neatly and legibly in black ink. Always sign your name and title. Document only facts, not opinions. Do not erase or use whiteout. Draw a single line through and initial any error. Reporting is the oral account of care and observations. Recording is the written account of care and observations, also known as charting. This is an example of the 24-hour clock or military times. AM times are in orange, PM times are in purple. This chart shows normal traditional time with its corresponding military time. The end of shift report occurs when the offgoing nurse gives report to the oncoming nurse at the end of his or her shift. This report gives an account of the care that was given, the person's current condition, likely changes in the person's condition, and new or changed orders. Bedside report is commonly used. For the CNA, the offgoing CNA will report observations to the oncoming CNA.